Hello, my name is Marquinn Duke. I'm the Trauma Medical Director here at North Oaks. We're a Level 2 Trauma Center and currently seeing people from various types of injuries.
All right, Dr. Duke, why did you choose to become a trauma surgeon?
The short story is that I had a cousin who was killed in a carjacking when I was younger, and so that kind of spurred me to go the medical route and take care of patients. And then while in medical school, I saw the benefit of seeing patients and seeing how what I did acutely benefited them. And it sort of met my personality and knowing that I could fix somebody right then and there and in an acute setting. And so that's what drew me to trauma.
Awesome. So I have a question from Kristen. What does it mean to be a Level 2 trauma center?
So there are three types of trauma centers in our state. There's level 1, 2, and 3. Level 1s are typically attached with schools and academic centers. So you have residents, you have research. Level 2 centers are very similar in that you have a lot of the interventions that level 1s have, but it's not mandated that you do research, and we typically don't have residents. And then level 3s is the next step down, where you have a number of resources, but not quite as many as a 1 or a 2.
So our trauma center operates 24/7, 365. What services are available to trauma patients as they come through our doors?
So our center, like I said, is level 2. We have in-house trauma surgeons who are here 24/7. We are double board certified in both general surgery and critical care. We're in-house and we're always here, ready to go. We have 24-hour coverage for orthopedic surgery, neurosurgery, as well as interventional radiology. For those that don't know what that is, those are the radiologists who do specific interventions and can do, coil embolizations, things like that, put in stents, things that are less invasive than some of the other types of surgeries. And then we have 24-hour cardiothoracic surgery coverage as well.
So what's the difference between a trauma and emergency?
They sort of overlap. So some traumas are not necessarily an emergency. If you fall and have a wrist fracture or fall and have a hip fracture, those are considered traumas. Whereas an emergency, especially in the trauma setting, a bad car crash, a fall, various injuries that can be associated with high speed impact, high speed deceleration, those kind of fall in the category of trauma where we get called. However, an emergency could be a heart attack or a stroke, which we don't get called for.
What types of trauma does your team respond to most often?
So most often going to be car crashes, ATV crashes, falls from a significant height. Those are kind of the three categories that we get called out for what's considered level 1 or level 2 activations. A level 1 activation means there is a mechanism and or physiology that is consistent with a severe injury. And so we respond to those very rapidly. Most of the time, if we get notification prior to the patient getting here, we're in the room waiting for them when they arrive. With the level 2s, it's similar as long as we get notification. It's just the response time is mandated differently for the two. And again, those are based off of the mechanism of injury as well as the physiology of the patient and the risk of something really bad happening. Level 3 consults are traumatic injuries that aren't an emergency, that may get evaluated by the emergency doctor, who then calls us if it's something that we need to be dealing with. Also on the level 1s and 2s, the way that we have it here, which I think is a benefit, we have the emergency doctor respond, we have the trauma doctor respond, we have a number of nurses respond. For the level 1s, we also have the OR respond, so that way the OR is there and ready to go. If it's an injury that needs to go straight to the operating room, they're there from the onset. We have anesthesia respond to those as well, so if somebody needs to be intubated, anesthesia's there, and if we have to go straight up, they kind of know the whole process of what's going on with the patient since they've hit the door and already have knowledge of what's going on with the patient, what we want, and what the plan is for care.
Awesome. So our area seems to experience a lot of ATV injuries. What is happening and how can we prevent this?
So again, that is one of the things that's ongoing. We've had a few radio interviews where we discuss ATV safety, mainly kind of educating the public on what the safe things with ATVs are. ATVs, anything, can be called a four-wheeler or side-by-side, things of that nature. The main things are going to be safety. So wear helmets, wear the proper gear, know that, what the rules are, who can and cannot be on an ATV, whether it's, child, adult, things of that nature. I think most kids who are riding ATVs shouldn't be. And in addition to that, knowing that if it's designed for one person, that only one person is on that ATV and we're not having two people on it. Additionally, ATV is designed for off-road, so anytime you're riding it on a concrete street, the tires aren't designed for that, so that can increase the risk of an injury. Normal safety things similar to riding a car. I mean, it is just a small car in a lot of respects. So knowing what the safety mechanisms are, knowing how to use the instrument properly, not drinking while you're riding it, not being on drugs while you're riding it, those things like that.
How about golf carts? Do you see anything come through with them? Since it's summer months, kids are going to be riding them through the neighborhood. Do you see?
We see some. Not as severe usually as the ATVs, just because they don't go as fast. So every summer we'll get a couple golf cart injuries, but definitely when you compare that to ATVs are higher.
And since we are approaching summer break, what are some tips maybe for parents or caregivers to keep their kids safe this summer?
So again, with the summer months, we're in Louisiana. There's water everywhere. Water safety is a big thing. Whether it's boating or in a pool, know what you're doing. Try not to be, or I shouldn't say try, don't use alcohol or drugs while you're doing these types of events. Watch your kids. Kids are spontaneous and they do things. Pool safety is very important. Every summer, unfortunately, we have kids who, for whatever reason, have drowned in pools and things of that nature. So make sure that you're maintaining all the pool safety things. Also, with boating, we have people who are on skis, tubing, things of that nature. Maintain safety while you're doing it. We don't want to not have fun. We want you to have your fun, but we also want you to be safe, so that way you're not coming in with injuries because someone came off of a ski and you're going faster than what you should be. Things like that.
All right, we have a question too from Nanette. What does a Level 2 Trauma Center actually mean for our community?
So for our community, I think it's a big deal. In the past, before we had a Level 2 center, the significant injuries would have to go about an hour away, either to Baton Rouge or to New Orleans. And as you can imagine, within that hour, you have a long time that you can get sicker. So having a trauma center in our community means that we can treat you faster and get you stabilized and get everything done while you're here and close. Kind of goes back to the old saying of the golden hour, and that you want to try and have those severe injuries treated within an hour. If you're taking that hour to get to another facility, then that's more risk of something going wrong in that time frame. Also, if you think about it from just a functional standpoint, if someone's here in the community and they're injured here, that way the families that want to visit them, the friends that want to visit them, don't have to go an hour away in order to show their support. And that helps a lot with healing, knowing that you have a support system, that they can be there to help you make it through whatever injury that you've had.
I know you're very involved in injury prevention. What type of injury prevention education are you a part of, and what does North Oaks offer in terms of that?
Yeah, so that's one of the things that is, as a trauma surgeon, we try to get out there, is to try and decrease the risk of injuries. Some of the things that we do, which is through the American College of Surgeons, is Stop the Bleed, and that's a course that's nationwide that we're teaching some medical professionals, some lay persons, how to use tourniquets, how to pack a wound, things like that. There's Play It Safe, which we have once a year, which sort of teaches safety, and that's growing every year, where we talk to kids initially, but we'll also talk to parents about things that we can do in our community to be safer, whether it's bike safety, ATV safety, car safety, home safety, things like that, even kind of off-roading type things. In addition to that, we have Sudden Impact, which we go to schools and talk to children about their behaviors and what they can do to be safe when they're driving, what kinds of injuries you get from driving and distracted driving, things like that.
What about child passenger child seats?
That is also one of the things that we do, is when we have kids who are born here, every day, we educate the parents on how to safely install car seats, the proper maintenance of car seats, and making sure that you have a car seat that's the right fit for your child, whether it's an infant, toddler, so on and so forth.
Can you talk about any of the upcoming events we might have going on in the community?
Definitely. So For the average person, lay person, for all those in the community, we are having a Play It Safe campaign that is going to be on October 6th. That is, this year, it's going to be combined with LOPA, which is the Louisiana Organ Procurement Agency, and we're going to have a 5K walk that is immediately preceding the event. The event's grown in the years that I've been here, and every year it's fun. We do it in the fall, and it seems to be a fun time for the family, for the kids. We have a lot of food, we have events for the kids, and things that we can do to kind of keep them having fun while they're learning about being safe. Additionally, for the medical professionals, we're having our second annual trauma symposium, which is going to be on November 2nd. And for those two events, we're going to have more details to follow.
All right. Do you have anything else that you'd like to add before we sign off?
So again, Level 2 Trauma Center here at North Oaks, we are here. We're ready for anything that you have coming in. Hopefully you won't. One of the things, again, that we try to do is prevent any kind of injuries, but know that we have somebody here 24/7 to take care of you if you do.